For those of you who are starting to join the call, we will start in about 1 minute. Good afternoon, all. My name is Lee Jebb, and I'm the chairman of the board of directors of Prairie Mountain Health. I'd like to welcome you to our 2019 and 20 annual meeting. On behalf of the board of directors, we're very pleased to have you here today. Before we start, I have a few housekeeping items for you. We will have microphones muted for only those who are speaking in order to avoid noise interference today. The chat feature of this meeting is turned off. However, if you have questions throughout the presentation, you may ask by clicking on the Q&A button instead of the chat at the bottom of your screen and just typing the questions. And you can ask those any time all the way through, but we won't answer them until the end of the meeting. If you are joining us by phone, you can submit your questions via email to communications@pmh-mb.ca. That's communications@pmh-mb.ca. Questions that we don't get to today due to time constraints will be answered to you directly by email following the meeting. Our communications team has promised that you'll have a response within 24 hours. It won't just be me that you see on your screens today. We have a panel and we have some help today. So some of the other faces that you'll see today is Penny Gilson, who is our CEO of Prairie Mountain Health. Brad Collette, who is our treasurer, Shelley Mashamansky, who is our chief financial officer here today, and Carrie Solomon, who is our communications coordinator. So I'm pleased to call the meeting to order. Before we start, I wish to do a land acknowledgement. The Prairie Mountain Health acknowledges that it provides services in facilities and sites located on the original lands and traditional territories of the Cree, Dakota, Ojibwe, Oji-Cree, and homelands of the Métis. PMH respects the First Nation treaties were made on these territories, and we dedicate ourselves to continued collaborations in partnership with Indigenous populations in the spirit of reconciliation. So welcome to the 2019-2020 annual general meeting for Prairie Mountain Health. Holding our AGM virtually is a first for our organization, but beyond the obvious precautionary rationale in relationship to COVID management, I think it makes the process more accessible to a larger cross-section of the citizens of Prairie Mountain Health. Prairie Mountain Health is about the size of Nova Scotia geographically, and many of our systems don't have the mobility, time, or means to attend in person. So from my seat, going to video is a good thing. Prairie Mountain Health currently operates under the direction of 11-member board appointed by the Minister of Health, Seniors, and Active Living. The board's mandate and responsibilities arise from the Regional Health Authorities Act. The Act provides the legislative responsibility and authority to plan, manage, deliver, and monitor and evaluate health services within the region. The board does this in a variety of ways, including providing sufficient oversight measures and ensuring the organization's accountability by monitoring and evaluating its performance. This includes interacting and communicating with its stakeholders and partners, which includes the general public. Though board members reside in various communities throughout the region, They represent the entire region at the board table. As chair, I consider myself very fortunate to lead a highly engaged and talented board of directors that bring exceptional commitment and a wide cross-section of experiences and talents to the board table. Even with the depth of our board members bring to the task, it takes a lot of work for a volunteer board, largely comprised of health system laypersons, to responsibly guide an organization of this complexity and scale. Prairie Mountain Health and the healthcare system generally represents the most technically and organizationally complex system in our society. Health is easily the largest employer in our communities with almost 8,000 employees and uniquely touches every single citizen in every community, our neighbors, our friends, our families, every one of us, often the most vulnerable times in our lives. It's big, it can be challenging, both emotionally and intellectually, and it can be highly political and morally sensitive. As board members, we all feel the weight of wanting to do it right in fulfilling our responsibilities to the community in this undertaking. After every meeting, I usually go home thanking goodness for the executive management team, our leadership partners in the organization. The board members of Prairie Mountain Health are Mark Frisson, who's our vice chair, Brad Collette, treasurer, Wade Schott, Wanda Sandy, Gwen Drool, Murray Perot, Donna Davidson, Carla McLean, Dwayne White, and Lon Cullen. I thought I'd, just before we start, pass the baton for the rest of the presentation, I thought I'd share with you some of the priority areas the board has been focusing on since our last annual meeting. So some of those priority areas have included healthcare transformation. We are part of a larger provincial process to update the design and delivery of our healthcare system. I see this as an important generational level opportunity to refocus our system to better meet the needs of Manitobans. Second is healthcare human resources, are a regular portion of our agenda. Our people are the most critical resource we have, but there's a lot of work to do in this area. The third priority area that we've been addressing as a board is governance, and particularly finance. We've been working hard as a board to truly and effectively engage with the management team in furthering the interests of the organization. Fourth is community and stakeholder engagement. There are almost 200,000 residences that are served by Prairie Mountain Health. Managing how we connect to patients, residents, and communities is an important consideration in running this organization well. But much like the rest of society, the organization's agenda, Prairie Mountain's health agenda, for much of the year has been dominated by the COVID-19 pandemic. As you would expect, the COVID pandemic is a uniquely trying circumstance for the healthcare system. Even when caseloads have been low, the impact on management and back office workloads, the day-to-day working conditions of our frontline healthcare workers, and the care environment for our patients and residents has been significant. The COVID response has added complexity and stress to a highly complex and dynamic system that by its nature manages crisis pretty well as part of its everyday business. Our Prairie Mountain Health teams have done well meeting the evolving health and communications and province-wide collaboration required under the demands and challenges of the pandemic. External partners in business, local government, private service providers like your local doctor's office or physiotherapist's office, your government MLAs, your chamber, have all stepped up during the pandemic. I can proudly say Western Manitoba has done a great job working together in our collective response. And from the healthcare provider perspective, we are grateful. I know with an organization as large as Prairie Mountain Health and with the challenges facing healthcare in this situation, that I haven't even scratched the surface of the contributions and sacrifices of all those who have made a difference so far in this pandemic, both inside and outside our organization. But you know who you are, and you know what you've brought to the community. I can, though, speak to one of our healthcare champions today. Our CEO, Penny Gilson, announced her retirement plans at our last board meeting. Penny has been our one and only CEO since formation of Prairie Mountain Health and has been CEO of this and predecessor health authorities for 20 years. With a lifetime of commitment to the health of Manitobans, she served as a nurse in the area of cancer care in Winnipeg, maternity nurse educator in Brandon, the Director of Nursing in Deloraine, Manitoba Health Liaison to Southwest Manitoba, Executive Director of Programs for Western Manitoba, and as CEO of 3 generations of Western Manitoba health authorities, including this one. Penny has been a tireless champion for healthcare in Western Manitoba, always competently doing her best for the employees, the patients, and the diverse communities of the health authority she has served. She has been exemplary in the most important of callings, the taking care of all of us. Even though Penny will continue as our CEO for the next several months, the accolades start now. So Penny, from all of us, a most sincere thank you for your service. And the best I can do in a video conference, Penny, is a big thumbs up and thank you. So Penny, with no further ado, I'd like to call you to present highlights from our annual report for the period April 1, 2019 to March 31, 2020. So with no further ado, Penny Gilson, our CEO. Penny, over to you.
Good afternoon, everyone, and thank you very much, Lee. That last part was not part of the script I saw for the meeting, but anyway, we'll go with it. It's my pleasure on behalf of the Prairie Mountain Health Executive Management Team to provide you with some operational highlights from our 2019-20 fiscal year. Obviously, the time we have today does not afford me to tell you about all of the great things that are happening across Prairie Mountain Health, so I really sincerely hope that you will continue to take a look at our website to get updates about our programs and services. I will start, as Lee has already mentioned, we entered an unprecedented time earlier this year when the World Health Organization declared COVID-19 a global pandemic. I can't begin to describe for you all of the activities that have formed our preparedness and response to that. But what I can tell you is that I'm extraordinarily proud of our staff, physicians, and volunteers who stepped up and continue to go above and beyond to make sure our clients, patients, and residents get the best possible care that they can. For that, we sincerely thank you. Next slide, our staff. As Lee already mentioned, we have close to 8,000 staff across Prairie Mountain Health who contribute to delivering all of our programs and services. I can't list them in all detail, but 7,700 people doing their utmost every day to make sure those who need us most are getting what they deserve from us. The region also works alongside a number of affiliate, or what we call non-devolved organizations. They are Winnipeg OSIS District Health Center, Dinsdale Personal Care Home in Brandon, St. Rose General Hospital, Dr. Gendreau Personal Care Home in St. Rose de Lac. And we actually interact with these organizations through a service purchase agreement. And even though they're not directly a part of our organization, we consider them a part of our team. We also have 2 non-for-profit long-term care facilities in Prairie Mountain Health. They are Valley View and Hillcrest Personal Care Homes, which are both located in Brandon. Next slide. As Lee also mentioned, I hope I'm not going to be redundant in some of my comments, but you cannot talk about healthcare in Manitoba for the last few years without talking about change. The health system in Manitoba has already undergone a number of changes associated with health system transformation, and there are more to come. The principles of health system transformation are efficiency, effectiveness, and sustainability, economy, role clarity, and simplification. Shared Health became a legal entity in 2018 and continues to play a lead and coordinate role on many health system transformation initiatives and the overall COVID response. They also deliver specific province-wide health services such as Health Science Center, and they support some centralized administrative and business functions. Manitoba Health Seniors and Active Living is also undergoing transformation with the ultimate goal that their focus will be on policy planning, funding, and oversight. A commissioning and accountability project was also just launched to advance work on overall accountability, on an overall accountability framework for the health system in Manitoba. Service delivery organizations have also been engaged in work aimed at aligning our organizational structures in a more consistent way across the province. There are also several shared service projects looking at things like digital health, health human resource services, supply chain management. And there's also an intent to develop and advance a provincial health human resource plan. Next slide. A large project, back. A large project within health system transformation is, of course, which I know many of you have heard about, is the Clinical and Preventative Services Plan. That report was initially released in November of 2019, and this process has been led by Shared Health. What will come out of this is a phased roadmap being developed to provide for more consistent, sustainable service delivery in Manitoba. The initial report that was released was developed with input from healthcare providers from across Manitoba. Our Prairie Mountain Health staff continue to be involved in many health system transformation activities. And as a part of health system transformation, effective April 1st, 2019, the following PMH programs and services were transitioned to shared health: diagnostic services, information and communications technology, and emergency response, or what most people would be familiar with as our ambulance services. Next slide. I'm now going to go through a few operational highlights. As I said, I cannot begin to describe all of the great work happening across Prairie Mountain Health, but I'll highlight a few things and I'll highlight them categorized according to our strategic priorities, which are capacity building, health system innovation, health system sustainability, improved access, improved service delivery, and improved health status and reducing health disparities. I also just want to mention that there are 4 provincial priority areas of focus being monitored and analyzed to drive improvements in the health system. Right now, these are improving client flow, including emergency department wait times, improving the health services experience for our patients, residents, and clients, improving safety of health services for our patients, residents, and clients, and achieving affordable and sustainable health spending. It is very much envisioned that as health system transformation in Manitoba continues, that for sure these priority areas of focus will continue to evolve. In terms of capacity building, Lee mentioned it as well, our human resources are our greatest asset. So recruitment and retention of health human resources remains a top priority for Prairie Mountain Health and continues to be challenging for us, especially in small rural communities. I'll highlight some of the key recruitment activities. We participated in over 30 career fairs at colleges, universities, high schools, and community events. Students from various disciplines continue to complete clinical experiences in facilities and programs throughout our region. Job shadows, credit hour programs, take your kid to work day are all great opportunities for exposure to the healthcare system that happen throughout the year. New nursing graduates have the opportunity to apply into what we have called rural graduate nurse mentorship positions, which were developed specifically to afford new nurses an opportunity to gain some confidence and competence in rural practice before starting their full practice. Next slide. In partnership with the Manitoba Healthcare Providers Network and Max Rady College of Medicine, Prairie Mountain Health hosted the annual University of Manitoba Medical Student Rural Interest Group, or what we call RIG, in January of 2020, as well as Rural Week in May. These weekends promote the benefits of practicing medicine in rural communities and lifestyle opportunities that exist. During RIG, a total of 48 first and second year medical students split their time between clinical workstations located at Brandon Regional Health Center and Country Meadows Personal Care Home in Neepawa. They also toured the Neepawa Medical Clinic. As well, for the first time, Prairie Mountain Health provided university and college students enrolled in health-related programs in Winnipeg the opportunity to participate in a bus tour that stopped in Brandon and Carberry. Nursing students joined their medical student counterparts participating in the clinical stations. And then we had students from occupational therapy, physiotherapy, and pharmacy who shadowed providers within their respective departments. The 2019 Home for the Summer program saw a total of 10 students throughout mental health, public health, pharmacy, health information services, and therapy services, and 4 medical students. Oh, no, back, sorry. We are able to offer these students employment for the summer, and that is basically cost shared with the province. So what this does is it actually keeps these students connected to their rural roots while they continue their studies in urban centers. During Rural Week, we had 35 first-year University of Manitoba medical students who were actually in various communities throughout Prairie Mountain Health. They included Brandon, Dauphin, Hamiota, Killarney, Minnedosa, Neepawa, Rivers, Russell, Souris, St. Rose, Swan River, Treeherne, and for the first time, Winnipegosis. In terms, next slide now, sorry. In terms of other capacity building, I wanted to share a very positive story about one of our programs. It's Ventures, that's located in Brandon. It's a work training program offered through Prairie Mountain Health Mental Health Services, primarily for individuals with severe and persistent mental health issues. The aim of the program is to help individuals experience recovery through the achievement of personal goals. Ventures clients made a very positive contribution to our COVID response. They were mobilized to provide several products, including plexiglass barriers and laminated signage for the region. At the request of Shared Health, the program also created cleanable plastic specimen boxes to transport blood samples to Westman Regional Laboratory. These specimen boxes have since been produced for every regional health authority in the province, as well as for Saskatchewan Health in Regina. So great job, Ventures. Another one is Dauphin's Parkland Crossing, which is a unique facility committed to addressing health inequities experienced by many community residents through a population health approach to service delivery. This former residential school has been transformed into a community hub that offers housing options, fitness and nutrition classes, access to public health services, social support networks, indoor playground, family center, food bank, spiritual support, and counseling services. Next slide. In December of 2019, we finalized and released our 5th Comprehensive Community Health Assessment. The Community Health Assessment is an important process that provides baseline information about how healthy we are, the factors that affect our health, and how we use the healthcare system. The process also tracks health outcomes over time, identifies opportunities for health promotion and disease prevention, and describes the conditions that contribute to health disparities. The Prairie Mountain Health 2019 Community Health Assessment will be used to inform strategic and operational planning, helping the region to identify priorities based on evidence from a variety of sources. The executive summary and full report can be found on our website. Next slide. Further to health system sustainability, virtual care services help residents access the care they need closer to home and support medical staff with timely access to specialists. This slide identifies some of the virtual services used in Prairie Mountain Health. I want to highlight some things about a couple of them, which is Manitoba Telehealth as well as Telestroke. During 2019-20, Prairie Mountain Health was the largest user of Manitoba MB Telehealth in the province, with 12,476 telehealth events, close to 87% of those being clinical in nature. Dauphin Regional Health Centre was the most utilized rural site for all of Manitoba. Telehealth helps to reduce travel costs and time spent away from home or work, provide access to health services that might not otherwise be available in the community, and give clients the ability to have family present during their appointments. There are currently 27 telehealth sites across Prairie Mountain Health. The Telestroke program is a collaborative partnership between the Manitoba government, regional health authorities, Shared Health, and the Heart and Stroke Foundation of Manitoba to help provide specialized emergency care to stroke patients in rural communities. Telestroke is a 24/7 emergency telemedicine application which uses video conferencing and CT image sharing technology, which allows our emergency department physicians in Brandon and Dauphin to access stroke specialists to assist with diagnosis of the patient's condition in a timely way and recommend a plan of care. In 2019, the service was accessed 93 times by physicians in the region. Virtual care has become a cornerstone of access through COVID. Virtual care platforms and digital health solutions will be a significant part of our new normal and future healthcare system. The Manitoba Renal Program is a complex service delivery model with 4 kidney health clinics and 16 local renal health centers located throughout the province. There is 1 kidney health clinic in Prairie Mountain Health, which is at the Brandon Regional Health Center, and they oversee the hemodialysis, peritoneal dialysis, and home dialysis programs. Dialysis services are also delivered in 3 local health centers located in Dauphin, Swan River, and Russell. In 2019, the Kidney Health Unit at the Brandon Regional Health Center expanded capacity to meet the growing needs of patients who require hemodialysis. We also expanded capacity at the local Renal Health Center in Dauphin by adding an additional shift. Improved health status and reducing health disparities. Prairie Mountain Health promotes and supports efforts towards making breastfeeding a priority and the normal nutritional choice for babies. Prairie Mountain Health is actively working toward a baby-friendly initiative designation with a target date for baby-friendly accreditation of 2022. In response to a significant increase in sexually transmitted bloodborne infections, and I'll refer to them as STBBIs, we're terrible for acronyms in healthcare, Prairie Mountain Health partnered with Brandon University to deliver on-site primary care to post-secondary students, including those from other countries. The intent of this initiative is to improve access to primary care and provide education for at-risk individuals using a harm reduction approach. Services are available on a weekly basis and include access to physical examinations, birth control, pap tests, prenatal care, medical prescriptions, mental health support, STBBI testing and treatment, as well as gender and sexuality health support. In addition, a public health nurse is available once per month to provide testing and treatment for chlamydia and gonorrhea. Health system innovation. Health IM is a resource available to Canadian Police Services to improve their crisis response and reduce the risk of harm. It uses a digitalized version of an application which allows for a secure connection with an emergency department. The goal of Health IM is to reduce apprehension rates, decrease hospital wait time, and enhance the care provided to citizens in distress. Through Health IM, Brandon Police Service, Brandon Regional Health Centre, and Mental Health Services have established a new pathway to facilitate assessment based on observation by police officers and assessment of the patients of the potential risks and support for a direct referral where needed. In December of 2019, Shared Health presented the Provincial Chronic Obstructive Pulmonary Disease, or what we refer to as COPD, System of Care Initiative, with a Health Innovation Award for Patient-Centered Care. The award celebrates initiatives that have directly resulted in improvements to frontline services which are seen and felt by patients and the public. The goal of the COPD system of care is to improve the patient experience through patient engagement and improved self-management, skill development, and transitions between community and acute care services. Prairie Mountain Health, along with Winnipeg, Northern, and Interlake Eastern RHAs, are currently involved in this initiative. In Prairie Mountain Health, the initiative is currently underway at Brandon Regional Health Centre and Swan Valley Health Centre with intention to spread further across the region. Enhanced Recovery After Surgery, or EROS, is a collaborative project between the Canadian Patient Safety Institute and Brandon Regional Health Centre that highlights best practices for colorectal surgery and consists of a number of evidence-based principles that support better outcomes for colorectal surgical patients, including an improved patient experience, reduced length of stay, decreased complication rates, and fewer hospital admissions. We have already seen a number of benefits occurring as a result of this Enhanced Recovery After Surgery program, and the intent, of course, will be to further expand to other surgical areas. Okay, next slide. Improved access to care. Prairie Mountain Health continues to enhance regional harm reduction services to address a significant increase in what I've already talked about, sexually transmitted and bloodborne infections. Public health nurses from across Prairie Mountain Health have undergone training in sexually transmitted and bloodborne infection testing and harm reduction, and may now directly order screening and diagnostic tests and provide treatment for chlamydia, gonorrhea, and syphilis. The Community Connections Unit, which is shown in the slide here, was launched in January 2020 and is based in Brandon. The program offers testing, treatment, and harm reduction supplies in the city of Brandon and surrounding communities, including to date, Neepawa, Killarney, Verdon and Erickson, Rivers, Dauphin, and Russell. Next slide. Brandon Regional Health Centre is one of the busiest emergency departments in Prairie Mountain Health, has been monitoring the time it takes to be seen by a physician. In an effort to further improve care and service and reduce wait times for patients, a fast track initiative was developed to assist with moving patients with less acute situations more quickly through the assessment process. If patients with less serious needs can be seen quickly, then emergency department staff will have more time to care for patients who require complex care. And the emergency department wait times is one area that Prairie Mountain Health continues to focus on. The relatively new MRI unit in Dauphin has improved access and reduced travel times for residents in the North Zone who require this diagnostic service. Since the opening of the Dauphin unit, we have seen a reduction in wait times at the Brandon Regional Health Centre. The mental health liaison nurse functions in a collaborative care model, and as part of the Emergency Department and Special Care Unit redevelopment project in Dauphin, this particular position was added to the team. This position helps facilitate hospital admissions, follow-up while an inpatient, and offers links to mental health and other resources as required. Next slide. The province of Manitoba expanded addiction services within Prairie Mountain Health. And in partnership with the Community Health and Housing Association, there was the addition of 6 residential, flexible length, non-medical withdrawal support beds suitable for individuals living with substance use disorders. Strong working relationships have been established between the Community Health and Housing Association, Withdrawal Support Services team, the Brandon Rapid Access to Addictions Medicine Clinic team, as well as the 7th Street Health Access Center that provides for a very effective collaborative model of care. These beds have now been operational for approximately a year and have received over 250 referrals. They have many clients that are so very thankful for their service. And a recent report suggests there are some that can't wait to put in an application for employment once they are stable in their sobriety. Next one. Improved service delivery. In early of 2019, the Crisis Prevention Task Force Incorporated was formed in Dauphin in response to some of the challenges they were seeing in their community, which was things such as increased food bank use, lack of affordable housing, increased substance use, stigma, child poverty, and lack of after-hours services. The task force researched existing services offered in the community of Dauphin to avoid duplication and identify gaps and opportunities for improvement. As a result of the project, the Under One Roof initiative was launched in November 2019 in partnership with the First United Church and the Dauphin and District Community Foundation. Meeting clients where they are at in the health spectrum, our Prairie Mountain Health staff provide outreach here through the Under One Roof initiative, which includes vaccinations, sexually transmitted and bloodborne infection testing and treatment, provision of harm reduction supplies, mental health supports, and other public health program and service information. One way we know how we can improve services is to ask clients and residents for their input. The home care program recently partnered with a client to review the education that we provide to our home care attendants during their education day and their skills testing day. The goal was to improve the safe working practices and overall home care clients' experience. Feedback from the client has now been incorporated into the education program to share with new hires and with current staff during refresher courses on an ongoing basis. An essential part of discharge planning is connecting with local resources in the community to support the care needs of patients returning home. Ongoing work continues in Prairie Mountain Health to improve connections with our First Nation home and community care programs. Prairie Mountain Health acknowledges the First Nation community, nurses, and healthcare providers who champion and work in partnership with us to improve discharge planning for clients who intersect those provincial and federal jurisdictions. In 2019, the province provided funding to each health region to implement a community falls prevention exercise program for seniors. Prairie Mountain Health chose to enhance the existing Steppin' Up in Confidence program, which is a volunteer peer-led exercise program to promote participant strength and balance to reduce their risk for falls. Classes are available for 60 minutes twice per week, with home exercise programs also available, and the initiative is offered in several Prairie Mountain Health communities. Our major capital projects, we completed the Brandon Regional Health Centre redevelopment project in 2019-20. An event was held in May 2019 to recognize project completion. Work actually commenced on this project in the spring of 2016 and was undertaken in 4 phases. The first phase involved relocating the pediatric unit and physiotherapy space from the hospital's 5th floor to the newly developed areas on the 2nd floor. The Westman Dreams for Kids pediatric unit opened for patients and families at the end of May 2017. Work on the project's later phases involved the medical unit on the 4th and 5th floors of the health center. Renovations created 12 additional medical beds in primarily single patient rooms with washrooms, as well as expanded, improved areas for storage, staff work, and family support. The province invested nearly $15.8 million towards this project, with the remaining $1.1 million coming from Prairie Mountain Health, and we thank very much the Brandon Regional Health Centre Foundation's Rooms for Renewal campaign. The Dauphin Emergency Department Special Care Unit redevelopment. There was a project or an event recognizing project completion in November of 2019. The new emergency department is 3 times larger than the previous space and began operating in late July 2019. Some of the notable improvements include enhanced treatment, exam, and observation rooms, reception areas, and waiting areas, a decontamination room, a new pedestrian access ramp at the back entrance of the facility, an enclosed ambulance garage, which allows patients to be moved directly from an ambulance into the emergency department without going outside or through public waiting areas, securing access to the ED area via identification cards, as well as locating the security services desk close to the emergency room entrance. The Dauphin Regional Health Centre is the second largest hospital within our health region, and with the completion of this project, we've provided for a modernized quality space for our patients and healthcare staff, and with many security upgrades, it also provides for a safer environment for everybody. Prairie Mountain Health recognizes the importance of communication with our internal and external stakeholders. We have developed several methods of doing that. The Prairie Mountain Health website, the Prairie Mountain Health staff intranet, Q-Link is a confidential question and general response process back to staff. Prompt is our weekly electronic staff bulletin, and Prairie Mountain Health Health Plus is a monthly electronic public newsletter, and we now have a significant presence on many social media platforms. Our complete 2019-20 annual report is available on our website under About Us Regional Reports. Going forward, some important points that we just want to emphasize as we move forward in Prairie Mountain Health. COVID is still with us, and we are needing to continue to be diligent in our efforts to prepare for and respond to the ever-changing demands of this pandemic. We have managed to do pretty well so far as a result of paying attention to the fundamentals, quickly identifying positive cases through testing and having them self-isolate, quickly and accurately tracing close contacts of positive cases. This has been an enormous amount of work on many fronts, but in particular for our public health staff. So I really want to specifically acknowledge them here. When it comes to COVID, we cannot let our guard down. We will continue to be an active participant in health system transformation, and a priority over the course of the next few years will be in particular clinical and preventative services plan implementation. We need to also be consciously working on the fiscal sustainability front, and we will continue to do that. We need to be relentless in our health human resource recruitment and retention. Efforts will need to be put towards ongoing mental health and addictions issues using a harm reduction approach. And we were to have our full accreditation survey as Prairie Mountain Health this fall, but however, that has been deferred due to COVID. So we are planning right now that we will move into our full accreditation survey in the spring of 2021. And that concludes my comments for today.
Thank you, Penny. Well done. That's a great presentation. Just before we move into our next presentation, I will remind you that we have a question and answer session following our next presentation. I would encourage you, if you have any questions that have come to mind so far, forward them to us now, and that way we can be a little bit better organized for you when the Q&A session comes. So we're accepting those questions anytime. So next, next part of our agenda, I'd like to invite Brad Collett, the chair of our Finance Committee, to present our audited financial statements for 2019 and 2020. So Brad, I'm going to pass the forum to you, and it's all yours.
Thanks, Lee. Welcome everyone to the boring accounting part of the annual general meeting. The finance chair, as you see on the slide, the finance committee of the Prairie Mountain Health Board is new in the last few years, but it includes an excellent group, including Board Chair Lee Jebb, Vice Chair Mark Friesen, and board members Gwen Drill, Lon Cullen, and myself. We meet at least 10 times a year to review the financial status of Prairie Mountain Health. That includes reviewing the monthly, year-to-date, and comparison to budgets, as well as trends and financial dashboards. We also review budgets drafted by the management team and recommend approval of financial matters to the board of directors. New this year is a process that allows both the finance committee and the board itself to have advance input into the budget process in terms of high-level priorities. Finally, the finance committee is involved in recommending the appointment of the external audit firm, which is currently MNP LLP, and reviewing the annual audit results. Next slide. The annual report includes a summary version of the annual audited financial statements. For those interested or curious, and I'm sure there'll be a lot, a full and complete version can be found on Prairie Mountain Health's website, which is prairiemountainhealth.ca. I'm pleased to advise that Prairie Mountain Health received a clean, unqualified audit opinion from MNP this year. What that means is that based on MNP's independent audit work, it is their judgment and opinion that our financial statements present fairly the financial position of Prairie Mountain Health for the year ended March 31st, 2020, in accordance with Canadian generally accepted accounting principles. Next slide. The statement of financial position shows a fairly substantial change from the prior year, as you can see here under assets and liabilities. Specifically, both the assets and liabilities decreased by large amounts, about 19 million in assets and about 16 million in liabilities, including almost every single line item. This is mainly the result of the creation of shared health in 2018, as referred to by Penny, by the province of Manitoba, and the transfer of operations for Brandon Diagnostic Imaging, emergency medical services or ambulance, and the information and communications technology to that new provincial entity. So the operations were transferred, but not the capital assets. As you'll note, the capital assets haven't decreased that much for the various programs. That's delayed until 2021, 2022, awaiting an order of council in the legislature. Obviously, I'm just touching on the really large changes, but Prairie Mountain Health senior management and financial staff can answer any more specific questions. Almost every line also refers to a note to the financial statements, and if you're interested, I would encourage you to go to the financial statements and look up those notes. They provide quite a bit of detail for each line item. Next slide. Statement of operations, obviously this is summarized fairly substantially, but the statement of operations, also known as the income statement in for-profit businesses, shows that revenue has decreased by revenue has decreased from the previous year by about $57 million. This relates to the change in global funding for the programs previously mentioned that were transferred to shared health. Similarly, expenses have also decreased fairly drastically by about 45 million and also relate substantially to the programs transferred to shared health. Prairie Mountain Health did experience some cost increases this year, relating mostly to the need for agency nurses and increased overtime costs. These result from some vacant staff positions at various hospitals and personal care homes in the region. In summary, Prairie Mountain Health ended the year with about a $12 million deficit, which is comprised of an operating deficit of 5.7 million and a capital deficit of 6.3 million. So what caused these deficits? Many factors in the operating deficit, but the major contributing factors included a decrease in residential charge revenue in personal care homes due to a number of vacant beds throughout the facilities in the region, increased staffing costs due to overtime and agency nurses and healthcare aides, HR challenges, increased expenses for prescription drugs, medical supplies, linen, repairs and maintenance, and utilities. With respect to the capital deficit, this is just simply a timing difference from the funding received from the province for capital assets compared to the actual depreciation of the related capital assets for accounting purposes. A little bit difficult to explain, but they fund differently than the depreciation that's shown in the financial statements. Next slide. Thought we'd show you the expenditure by program service for your 1920. This busy chart shows the allocation of expenses between the various programs and services within Prairie Mountain Health. In other words, where does the region spend its funds? The large blue area, 38.8%, relates to acute care, also known as hospitals. The next largest area, 25.1%, relates to long-term care or personal care homes. Together, combined, that makes about 64%, and I think most people would expect that would be where a region would spend their funds. 15.9% includes the total for community-based services, and that includes about 7% for home care, 4.7% for community health, and 4.3% for mental health services. And another large area is 8% relates to physician remuneration. That's salaried and contract physicians only, as they are paid by Prairie Mountain Health, whereas fee-for-service doctors are not included as they're paid directly by the province. Next slide. A lot of people are very sensitive to administrative costs in public entities, and healthcare, that's no different in healthcare. In 2019-2020, our administrative cost percentage indicator as a percentage of total operating costs was about 3.91%, which is fairly consistent with prior years. Across Manitoba, as broad health system transformation initiatives were implemented throughout 19 and 20, administrative costs declined as a percentage of total operating costs for the healthcare system as a whole. This included the RHAs. If you'd like more details on this, on administrative information, I'd encourage you to look at pages 46 to 48 in the annual report, as it details Prairie Mountain Health's administrative costs. That's a very quick summary of Prairie Mountain Health's financial results for the year. I'd like to thank Shelley Mushimansky and the financial staff for their hard work in the day-to-day accounting and reporting, as it's a huge but important job. I'd also like to thank MNP and their audit staff, as this was a particularly difficult year to audit organizations like ours due to the COVID-19 pandemic. So with that, I'll pass it back to Board Chair Lee Jebb.
Thank you, Brad. Well done. That brings us to the end of our presentations, and now we are to our question and answer session. We have approximately 15 minutes before we adjourn at 1 p.m. So a reminder, to ask a question, please click on the Q&A button at the bottom of your screen and type a question. If you don't have the opportunity to ask your question during the session, please email it, your question to communications@pmh-mb.ca, and your question will be responded directly to you. Right now we have, I'm going to have some help if we have a bunch of questions come in with our communication coordinator, Carrie. So Carrie, do you want to start us off? Do we have a question to put at our panel?
Yes, hi Lee. This question was from Emily, and she has asked that Brad answer it, although it could be Penny as well, so get ready. And could you clarify what term agency nurses mean? What the term agency nurses mean?
I can deal with that one, Brad, if you'd like.
Sure, go ahead.
I mean, Brad can probably capably answer it. These are nurses that we actually contract from independent agencies when we aren't able to fill some of our vacancies in nursing. So we actually work with several independent agencies to access nursing resources if we have considerable gaps in our service delivery. So usually it's registered nurses, licensed practical nurses, and healthcare aides are the primary staff that we contract with independent agencies for.
Excellent.
Penny.
Thank you, Penny.
So we don't have any other, we're still waiting for other questions to come in. And so I'm going to throw one at Penny. Penny, through the COVID pandemic and our response to it, we've worked quite closely on a province-wide basis and how we've responded. And I've really enjoyed watching how well that's working from the board seat. I was wondering if you would share with the people that have joined us today your insights and your observations on what exactly happened there.
Yeah, so once I mean, all regions were certainly doing preparedness work prior to the declaration of COVID-19 being a global pandemic. But then, of course, with the first cases being declared in Manitoba back, and I think the first one was a presumptive case was in March 12th earlier this year. Quickly, we all moved into what we call our incident command structures, and there was an incident command structure set up provincially that we were all integrally part of. So we were working very closely as a province to ensure that our response was as comprehensive as possible, but also that we were being as consistent as possible in our response across the province. As well, I would like to say that, for example, when we had a surge in cases in the latter part of July and into August this year, certainly some of our other regional partners stepped up to help us in areas where we needed some assistance, such as things like contact tracing or active daily monitoring. And we continue to do that for other regions when they are also needing assistance. So it is very much about meeting this pandemic head on as a provincial health system, and we're working very close together on that.
Thank you, Penny. Carrie, you got another one for us?
Yes, we have one email question here, and it is, please respond to the October 15th, 2020 report in the CBC Manitoba News that the Dauphin Personal Care Home is operating at 40% staff level. That is, what is PMH's plan for reopening Dauphin PCH and St. Paul's Care Home to reduce the backlog of seniors in the community who have already been paneled?
Yeah, so we are aware that there are significant challenges on the nursing side at the Dauphin Personal Care Home. Right now, we don't, I'm pretty confident we do not have any issues or as many issues at the St. Paul's nursing home. So yes, we are continuing focused recruitment efforts in the Dauphin area. We actually have a committee that is specifically looking at what other additional recruitment initiatives can be undertaken for Dauphin and area. And we've actually done a couple of them over the course of the last few years, which is where we actually did our own in-house healthcare aid training program, and trying to look at any and all options. We look at things like, if we have term positions, would it increase our recruitment potential by flipping those to permanent positions? I will say that Dauphin and area is particularly challenging right now on the health human resource recruitment and front. So we are going to continue relentless efforts in that regard. We are going to be reaching out to organizations in Dauphin, such as the Dauphin Municipal Council, as well as the Dauphin Regional Health Center Foundation, and try to actively engage more community members in this discussion. We do know things like sometimes rental housing or affordable rental housing can be an issue in Dauphin that we've heard from some staff. So it has to be kind of an all sector approach to trying to address this particular health human resource issue in that part of our region.
Thank you. So folks, we are going to stay open here for a little bit longer for questions. I encourage anyone who has one to please click on the Q&A button on the bottom of your screen and type your question, or you can email us at communications@pmh-mb.ca.
So it's not a question here, Lee, that I have, but Dwayne White, a board member of Prairie Mountain Health, has written in our comment section that he wants to echo your comments at the beginning of our meeting regarding Penny's exemplary work for Prairie Mountain Health. Also, Swan River has a harm reduction committee as well, and it is doing a lot of work in that community as well.
Thank you, Dwayne. And I just wanted to say I've been very fortunate to have been able to serve in Prairie Mountain Health and the previous regional health authorities in Western Manitoba. And I am so very proud of every single staff member and physician and everybody that I've worked with. You have made me very proud.
Well said. So we're going to just leave it for another moment. Carrie, do you have anything else? Any other questions for our panel?
I have nothing that has been submitted so far through email or on our Q&A section.
Okay, well, I'm going to throw one at Brad. Are you still with us, Brad? There he is.
I am.
So Brad, we've worked hard to adjust and starting to work hard to adjust the timing of our budgetary process to allow us for some longer range thinking. Would you like to speak to that a little bit?
Yeah, I think obviously the first priority for any health region or any healthcare system is top-notch care. And I think that still has to be the overriding factor that we consider. But obviously cost effectiveness and cost efficiency is important too. So I think the board and the finance committee just want to get involved a little bit from a really high level, as I said in my presentation, a really high level point of view, and maybe give our thoughts to the management team. The executive management team and the whole staff do a great job putting the budget together. But typically it would come to us at close to the last minute, and we'd like to have a little bit of say. So that's a new process that we're working on, and collaboratively with the executive management team.
Thank you, Brad. Okay, Carrie, we're going to back to you. Do you have any other questions for us?
Yes, I have one from Murray, who is also a board member here with Prairie Mountain Health. And the question is, how will COVID testing be managed in the colder weather? Can you speak to the current testing sites and how they function?
So yes, we have at the Van Horn Avenue or Van Horn address in Brandon. It is a drive-through testing site. So, and we did move there specifically to deal with inclement weather coming up in the winter. We have also relocated our Dauphin testing site to an indoor site. It's a walk-in site, and we are also looking at an alternate site up in Swan River. But they will all be indoor testing sites for the winter. We also have Dynacare has set up a testing site at the Keystone Center in Brandon, and that is a kind of drive-up, walk-in type of testing site. But we should be able to manage all of our testing through appropriate venues to deal with weather this winter.
Thank you, Murray, and thank you, Penny. This last call for questions. Do we have any others on the system, Carrie?
Sure, I have one more from Emily, and her question is, what percentage of nursing staff or applicable positions are contracted from independent agencies?
I will flip that one to Shelley. She has, I think, some stats on the percentage.
And so Shelley is our Director of Finance. She supported Brad on his presentation. So Shelley, are you with us, and can you answer that?
Hi, thanks. Yes, certainly. So for 1920 fiscal year, the percentage of our agency as a percentage of our total costs was 2.83%. So I think that's answers your question, Emily. That was what was contracted from the agencies, 2.83. Thank you.
And agency staff really, it varies across the region at any given point in time, depending on where our vacancies are and our ability to recruit into the vacancies. Of course, we try to exhaust all other options in terms of filling those nursing positions, but we have to say that we have to be thankful for the agency staff that do come to our region to provide service, because that otherwise would have meant some service disruptions in some of our areas. So, you know, today it could be Dauphin, where we're seeing significant agency costs because of vacancies. Tomorrow it might be one of our smaller rural communities in the south. Again, we try to exhaust all other options before utilizing agency staff.
Okay, well, I think that is the extent of our questions. So your last call to you, Carrie. Any others that you're aware of?
I have nothing at this point. Thanks, Lee.
Okay, well, I'm going to adjourn our meeting now. So I'd like to thank everyone for joining us. I'd like to thank our panelists for their excellent responses to the questions and their excellent presentations. Thank you very much. And I'd like to thank any of you, all of you that have joined us today. So we'll consider our annual meeting adjourned.